I'm just going to try sharing here. Can you see some slides? Excellent. Okay, thanks everyone. So I'll whip through a bit of a EPI update on what's happening in public health land at the moment, and also acknowledge the beautiful Aboriginal lands on which we're all meeting tonight. So yes, in terms of acute respiratory illness, hopefully, touch wood, we're through the peak of the influenza season, which I think everyone will be very pleased to hear. Locally, RSV has come down, although statewide it remains at moderate level of activity. Also, COVID has come right down, and influenza activity remains high, but it appears to be turning a corner, which is great. We've certainly seen a bit of an unusual, sorry, just with the next one, you'll note here that the shape of, I guess, the epi curve for the past couple of winters, and this is our little sort of Christmas COVID that's been happening kind of interseasonally. But yes, you'll notice that there's been sort of quite a steep peak in the previous two winters, but this winter looks a little bit different with a bit more of a prolonged and sort of flattened out curve. And there's some speculation as to why that might be, but we've certainly seen quite a large flu B wave sort of coming at the end of the influenza A. So I'm not sure if that's been bearing out in your experience as well. And unfortunately, we've seen quite a bit of paediatric population affected with influenza B. And sadly, some quite severe cases and deaths in New South Wales, which does happen every season. But yeah, it's just, I guess, another reminder of the importance of vaccination. And just to mention, it seems like, I guess, the vibe around the offices of the Central Coast is that there's still a bit of respiratory activity happening around the traps. Probably there's a bit of an uptick in rhinovirus activity and also a bit of an increase in adenovirus. So this is all just taken from the New South Wales Respiratory Surveillance Report, which comes out weekly and has some really useful information on trends. But just on that point on flu vaccination coverage, we are tracking behind where we have, pre-pandemic in terms of influenza vaccine uptake. And of particular concern, I think, is in Aboriginal children and also in our older age group of the over 65-year-olds. And so we're sort of seeing well behind, this is New South Wales figures, and the Central Coast figures are somewhat better at, I think, about 64% for all over 65 year, all people aged over 65 years. So this is from data from the Australian Immunisation Register, and there's been a recent comms push to kind of put out that message that it's not too late to get your flu shot. So really appreciate the continued efforts of everybody in that space. Oh, yeah, this was the safety broadcast that came out a couple of weeks ago in relation to those, sadly, deaths and serious complications amongst children. But yeah, we hopefully are over the peak of that now. Another big news in public health is the changes to the schedule. So there's been a change to the pneumococcal vaccines, which is really exciting. So Prevnar 20 now replaces Prevnar 13 as the funded vaccine for children, and that's over a 3-dose schedule. And that started from Monday this week, which might have taken some people by surprise, but really it helps to streamline and simplify and provide more optimal coverage against the circulating strains. And there's also been expansion of the 4-dose pneumococcal vaccination schedule for Aboriginal and Torres Strait Islander children across the country, and removal of that Prevnar 23. So quite a bit of a transition phase. The National Centre for Immunisation Research and Surveillance, NCIS, is running a webinar on this. I can provide the link to that, but it will kind of give you all the details you need to know about the rationale behind the changeover, the benefits of it, and operationally what that will look like. And so accordingly, the New South Wales immunisation schedule has been revamped. It's all in pretty colours here. So if you do have a copy of this printed out, please take it down and replace it with this one, which has come into effect and is on the New South Wales Health website since Monday. It's designed to be printed in A3 size. So yeah, so great to have that kind of simplified and streamlined there, and including the updated changes to the pneumococcal. And I just wanted to finish with a quick plug. You might have seen an alert come out, I think, at the end of last week about an Mpox increase in New South Wales. So you might recall the substantial outbreak that we had of Mpox in 2024, primarily impacting gay, bisexual, and men who have sex with men and their partners. But that fortunately petered out with some strong messaging and advocacy and vaccination, sort of mass vaccination of the population. And we didn't see any cases for 2 months. The outbreak was closed, but concerningly, we have seen an increase in cases in Victoria, and now in the past month in New South Wales, we've had 10 cases. And I think the concerning thing about this is that they're primarily in not the previous demographic. So we've seen female sex workers impacted and also heterosexual men who have sex with female sex workers impacted. So I suppose those aren't typically the populations that were considered at risk in this previous outbreak. It does remain clade 2B, which is fortunate. So it's not the clade 1, which is considered to be more severe. But it is potentially causing more severe presentations because it's impacting people who have not been vaccinated. So the message really here is to have a low threshold for testing sexually active people with symptoms consistent with Mpox. So, I mean, if you're contemplating a diagnosis of herpes, certainly consider screening for other STIs, including Mpox, because it is frequently mistaken for herpes. And also to promote vaccination in all men who have sex with men. That message remains also for sex workers and anyone who has or intends to have sex with sex workers. And that vaccination is still available through our Holden Street Sexual Health Clinic. So that's a wrap. I'll leave it there.